Alrighty guys, that was the live resuscitation demonstration, and I hope it was helpful to see it and see how it should be done. It can feel in the moment chaotic, but remember to always stay calm and follow your neonatal resuscitation algorithm. Additionally, if you're in the moment and you're just standing there and you don't know what to do, always ask. Say something like, I don't have a job, what can I do? If you are just standing there, don't just stand there. Ask in what way you can help the patient. Ask, how can I help? And then go make yourself productive. Additionally, you always want to move with a sense of urgency, right? Like there is a life teetering in the balance, and we always want to make sure we're moving efficiently. Don't rush, don't go too fast, but make sure you are moving with a sense of urgency and being efficient. So one thing that is really, really important to remember is you can maneuver yourself, your BVM or your equipment, and even your patient when needed to make yourself more efficient. For example, if I have a BVM and I'm trying to ventilate the patient, I'm not gonna stay over here and ventilate the patient from over here. That doesn't make sense. So I can either move myself around to the head of the patient right here and use the BVM from this side, or I can even maneuver the patient safely, of course, safely maneuver the patient so that I can more efficiently and effectively do my job. So now I'm at the head of the patient and I can effectively ventilate. So going into ventilation technique, you always want to remember that you're using your CE grip. So the C goes around the mask, right? And your thumb and your index finger go around the sides of the mask and help make a good seal on the mask, right? And then your E portion of your grip is going to go under the patient's jaw to lift up their jaw into the mask. So you're taking the mask and you're using the C to make a good seal around the mask itself, and you're using that C, putting this onto the patient's face, but you are also using your E to lift the patient's face into the mask. Remember, you always want to help open the airway, and that also helps pull the face into the mask to get a good seal. So when you're ventilating, you've got your CE making a good seal, pulling the patient's face up into the mask. And when we breathe, we have good chest rise and fall, right? We're breathing at our rate, if we're just ventilating, of breathe 2, 3, breathe 2, 3, breathe 2, 3. Notice when I'm squeezing the bag, it is not a death grip on the bag. That is wrong, and that is going to cause harm to your patient. You can cause what's called barotrauma. You could even cause a pneumothorax. So you always want to gently squeeze the bag. It only really requires a couple fingers. It doesn't even require the whole hand to effectively squeeze this bag. I'm not squeezing too hard on the bag, so I'm not causing any trauma to the patient.
All right, so in the case that you have been giving effective ventilation to your baby and their heart rate is less than 60, you need to start chest compressions. So the way that you do that is by encircling your hands around the baby's chest, placing your thumbs in the lower third of the sternum, and usually that's just below where the nipples are. So you place your thumbs there, and the rhythm for chest compressions is 1 and 2 and 3 and breathe. So in the case that you have to give compressions, you are always providing ventilation as well. It's never just compressions. So the rhythm is 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe.
Make sure that the person doing chest compressions allows the chest to fully recoil after compressing to a depth of approximately 1/3 the thickness of the patient's chest. Additionally, about recoil, you always want to make sure you let your BVM recoil, as well as to let it refill with that supplemental oxygen that's in this reservoir bag right here.
1 and 2 and 3 and
breathe.
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 1 and 2 and 3 and
breathe. Alrighty guys, so When you start PPV, you do not stop until the heart rate is above 100 or the doctor tells you to stop. You do not stop doing PPV during a pulse check, so you continuously do your PPV. The only exception when you would very briefly just pause your PPV is if there are secretions or some sort of airway blockage that develops. You are going to briefly pause your PPV, suction the airway properly, and then make sure it is clear and resume your PPV. Remember, you never suction for more than 10 seconds in a neonate, and you're going to, after you clear the airway, resume your PPV. Then you will only stop once the heart rate rises above 100 or the doctor orders you to stop.
All right, and then for compressions, the only time you want to stop is for a pulse check, which should last no longer than 10 seconds, if the heart rate is above 60 beats per minute, or if a doctor tells you to stop. Lastly, I just want to mention for if you are in the NBU or if you're at a delivery and you need to do resuscitation for your baby, always ask for help. It is never a bad idea. It is never wrong to ask for help. And usually when you're doing a resuscitation, you need all the help you can get. So as a student, never be afraid to ask for help.
Okay guys, thanks for watching this video. We'll see you in the next one.